Preventative care covers things like cancer screenings, immunizations, and routine checkups. It also is covered in nearly all health care plans. Joining us now to talk about preventative care is Dr. Greg Glassner, the Chief Medical Officer with Blue Cross Blue Shield of North Dakota. Dr. Glassner, thank you so much for joining us here today.
Thanks for having me on.
So, doctor, tell us a little bit about what you do. You know, the topic of preventive care, really trying to catch a lot of these sicknesses, and certain disorders early if you can. Where does that come in?
Well, first of all, I'm a practicing physician. I still practice medicine. I'm an OBGYN. I practice clinical medicine 1 day a week, so I do preventative care every week. And the importance of preventative care is so hard to express the importance of it, because this is where you get on top of diseases before they become a problem for people, and it really impacts their life and their healthcare status. So, with preventative care, there's a whole list of recommended preventative care topics, and they're listed in almost everybody's insurance plan. And really, preventative care addresses most of the chronic conditions that affect America. If we can get on top of those, we can improve the life of almost everybody that goes in to see their provider. The problem is only about 8 to 10% of people go in and see a provider for routine preventative care visits.
Okay, and so you kind of talked a little bit about the chronic conditions. What are some of those chronic conditions that you guys see a lot of, and how can this preventive care really help with the costs of things like that, insurance premiums with things with chronic conditions? How can that help it decrease for patients?
Sure. So some of the chronic conditions we try to manage are like high blood pressure, asthma, diabetes. Those are the great American diseases that most Americans, they're overweight, they don't exercise, they don't eat right, they're not on medication to control these diseases. And eventually those snowball when they compound upon each other, and they create great distress for the human body. And as time goes on, that creates, need for heart surgery, amputations for diabetics, chronic kidney disease. All of those things could be prevented if we actually got in and saw a provider who can manage those on a preventative care basis. And you can eliminate or lower those risks almost to baseline if you're aggressive and you manage those. The problem is we just need to engage our members and everybody to go in and see their primary care provider, and they can take care of most of that just up front before it becomes a problem.
What is the most...
If you talk about cost, I'm sorry, go ahead.
No, I was going to say, Dr. Glassner, so what's the most common question you get asked? So for the average person thinking to themselves, I only go to the doctor if I'm sick, in incredible pain, or if I think I can afford it. And I can certainly relate to that, and I can understand that mentality. But what seems to crop up more and more when you go to have conversations with people and say, why didn't you come see me sooner?
Most people just don't want to take the time to go do it. A lot of the preventative healthcare screenings are covered on your basic insurance plan. So really, the annual wellness screening exams are covered. You've already paid for them, so there's no reason to make an excuse not to go see your provider. A typical example that we hear in the office all the time are immunizations. I'm not going to get my immunizations. I read something on social media that they're bad. Well, what is bad? Medicine by social media is bad for America. Listen to your provider who's got years of training about what's good for you or what's not good for you, and just let them dispel the myths. That COVID vaccines, I've said this before in other broadcasts, if you get a COVID vaccine, you have a 40% less chance of being hospitalized for COVID. If you don't get that vaccine, think of that, 40 times more that you're going to be admitted to the hospital, go on a ventilator, be sick for months. So just get your vaccines. They're safe, they're effective. They work. That's just one example. Another example are colonoscopies. People just don't like the idea of a colonoscopy. It's invasive. It's just not, the whole idea is not comfortable. Okay, colonoscopy might cost $2,500. If you don't go in and get your colonoscopy, you end up with colon cancer, you have surgery, chemotherapy, you see the oncologist. It's about $250,000 on average for that treatment. But the real benefit isn't the cost. It's the quality of life. If you just go in and have your colonoscopy, get those dangerous polyps removed, and then avoid the whole process of having to go see a medical oncologist, surgical oncologist, and then you live a much better life. Just go get your primary care screenings done, and we can keep you healthy if you just go do it.
And for most places in North Dakota, those screenings are offered a lot of times in your own neighborhood. So it's a lot a lot of times they are close. Our guest once again is Dr. Glassner, the Chief Medical Officer with Blue Cross Blue Shield of North Dakota. Doctor, I want to thank you again so much for taking the time.
Yep, thanks for having me. Appreciate it.